A little bit, Brad.
How are you doing today? Oh, pleasure to meet you, Bob.
Pleasure to meet you.
My name's Brad, by the way.
Oh, yeah. We're going to start in just a minute here. We're just getting the thing. We're going live for what is it, the fourth time now, Brad?
Yeah, three or four.
We haven't really gotten everything figured out yet.
The first one doesn't count though.
I want to see if we get on there, Brad, by the way. Because we're going to. By the way, if you're watching this after the not live version, if you're watching it on YouTube afterwards, please take a second to subscribe to us. We have a subscription button that's over here or down here, and we provide videos on how to stay healthy, fit, pain-free, and we upload every day. How you doing, Brad? Nothing going on?
I'm looking for.
Now we're live, so if you're out there, go ahead and say hi to us. I think it should be right here. Oh, that's the introduction. Go under. Sorry for this, folks. We're going to get this straightened out here. Where's our playlist videos? Should be under that. I don't see it, do you? Maybe we get one of our girls in here. Technical difficulties here. And put out a comment if you do. If you're listening to us. By the way, Brad's going to get some help. But our title of our video today, by the way, is how to choose a pillow for neck pain, pinched nerve, or herniated disc. And there's three factors that you're going to want to consider when you do this. You're going to first consider your sleeping position. Do you tend to sleep on your back, on your side, on your stomach? And then we're going to look at your neck pillow size. Because the bigger you are, obviously the bigger pillow you're going to need. And then we're going to look at some different pillows as far as their fillings. So hopefully Brad's going to come back here one of these days. But right now, what I'm going to talk about is neck pillow positioning as far as if you're on your back, if you tend to be a back sleeper, you're going to have one thin pillow or a pillow that's not as thick because you don't want to be on your back and be in this position right here, like this. That's the worst thing you want to do. You want to have kind of your ears lined up with your shoulder as much as possible so that you don't you get yourself in this forward head posture, which makes a herniated disc, a pinched nerve, everything much worse. The other thing I would suggest, and we'll show some of these things at the end, but if you're having pain down one arm, I would actually take another pillow and put it underneath that arm for some support like this, because it's going to take some of the pressure off the nerve, the pinched nerve that you're having trouble with, or even like this. These shall work. Now, if you're a side sleeper, now you have a bigger gap to fill in here. Now you have to fill this gap in. So you're going to want to use a thicker pillow or two pillows. So you're right in the middle again. You want the head in the middle of the body as much as possible. That's what you're always shooting for. Now, as far as sleeping on your stomach, we're just going to recommend that you really try not to do so. Because if you're on your stomach and your head is turned all the way one way or the other, it's just bad for the neck all night long. The body does not like it when your neck is turned all the way in one direction or another direction for long periods of time. Brad, are you going to join me someday?
Sure, Bob. You were doing such a good job. I thought, wow, let him go.
Hi, I'm Bob Schrupp, physical therapist.
Brad, I'm a physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
We have had great difficulty, Brad, with trying to figure out the comments section. And maybe if anybody's technologically inclined out there, you can help us. We get everything all set up. We have the comments enabled. We're on Chrome, and for some reason the comments don't come up on our computer.
And we've got it plugged in.
Yeah, we've got it even plugged in. So, all right, let's start talking about some of the pillows, Brad, that you can use here. So you've decided that if you're a back sleeper or a side sleeper, you're going to get the position that's going to fit you correct. But we got a whole bunch of different ones here that we're going to talk about. Let's first talk about this Green Moon, Brad.
Sure.
So this is a pillow that was sent to us. This is a guy, he said he's been selling this pillow for 23 years. Okay. This has not been in the United States. I think he's just coming to the United States now. So this, we're of what you'd say Western medicine, Brad.
Sure.
So, this type of, because it's very solid, very hard.
Maybe we should say it to us Minnesotans and Wisconsinites.
That's right.
In the Midwest, perhaps on the East Coast and the West Coast, it's a whole different story.
So we got some comments, by the way, Brad. So why don't you lay down, Brad, with this?
I'll take a nap.
So,
all right. So I'm looking at this. There's a it's not a perfectly flat pillow, and you can feel the groove in there, and it fits right. Not a groove, but comfortable. It is on the firm side.
Yeah,
So
I don't
you
think
have
you can, I don't think you really lay on your side on this one, Brett.
doing that before, and I actually think it fits pretty good in there, Bob. I would not be too afraid of doing this, especially
Now,
on a bed.
What's nice about this is very well made, and it comes with two pillowcases, and the pillowcases are 100% Egyptian cotton pillow case.
Excellent,
So,
and you can't go wrong.
But it also comes with, now this again, this is out of our wheelhouse, but these are Haitian jade minerals
Yeah.
and also medicinal herb pack.
So there's a little aroma that goes along this with that. So all night you can smell this and have this therapeutic sleep with that.
So I understand jade is supposed to be among the emperors and kings used to like jade.
Sure.
And so
Yeah, someone out there is probably going to help us out.
we're getting a lot of nice comments, by the way, Brad. I'll talk a little bit about some of those.
Sure.
Stephanopoulos, he uses his smartphone to read the comments. That's not a bad idea. That's a good idea.
Yeah.
And someone who had shoulder surgery, Jenny, and she's still in pain, almost 1 year. We're gonna have to talk about that, huh?
Mm-hmm. Oh yeah.
Let's get your camera level tilt to the right. It's hurting my neck.
Oh, we don't want to cause a problem there. We're talking about ergonomics.
I don't know. Is that right?
I think she's talking about it this way, Bob.
Oh, is it which way? Oh, we try to respond to people here.
Yeah.
I don't know if we can change it anymore that way. But
I'll get it.
Brad's gonna do it. Okay, I'll go to the next pillow, Brad. Again, thank you, Green Moon Orthopedic Pillow. It's $59 or so on Amazon. Again, you're gonna have to want a firm pillow on this one if you're gonna try this one because it's very firm. All right, let's go to the one that you've been seeing. It's kind of ubiquitous, Brad. Is
Ooh, big word, Bob.
the My Pillow.
Yeah.
And what's interesting about this guy that invented this Mike Lindell, he's actually from my hometown.
Oh, really?
Or near my hometown.
Mhm.
He's in Carver, Minnesota, and I was from Norwood.
No.
So, and he owned 4 bars, so I probably was there at one point. And he sold his 4 bars, and he had this epiphany that he wanted to start a pillow company.
Sure.
And this pillow is filled, what he took a long time to figure out. It's basically open cell polyfoam, and there's different sizes. And he experimented over a long period of time, months, of what sizes to have in there. So he's got some bigger ones, smaller ones, because he wanted to be able to mold it.
Right.
He wanted to form it and mold
Fit
it.
to your body
And fit to your body, right.
Shoulders.
And so it's a patented thing, and they come in different densities and firmnesses. So
Okay.
yeah, so you'll have to go to their website. We have it down below. They run from anywhere from 50 to, you can spend over $100 on some of these pillows.
Sure.
But I took a nap on it. It was really nice. It was worked out good.
Right.
I thought it was a good pillow.
Yeah,
So
I think it's got a nice. If you're not happy with it, I think you can send it back.
you can, and
And
he says
you
he
get
gets
your money back.
He says he gets very few back. So
Right.
that's kind of interesting.
Yep.
All right, the next one is a memory foam contour pillow. And I can give a little testimonial to this one. My daughter was having trouble with TMJ, and we did some other things too, some physical therapy things, but she started using this, and she actually did help it to the point where she wasn't waking up with pain anymore.
Okay, so good positioning in bed help.
Do you want to lay down on this one?
Yes,
Brad?
I do. So you can see it's got a dip in here, and this is that memory foam. It's kind of neat. You can push into it, and it holds that.
Hi from
position.
Toronto, Canada.
Oh, hi, Toronto, Canada. Oh, I haven't been up there yet, Bob, but I'd like to get up there.
Yeah, so would I.
Boy, this feels nice. I do like these
North
memory
Carolina, Cape Town, Mickleville. Memory pillow with the wave has worked the best. Someone says that's Dave.
foams. Okay.
So
All right, Dave. Thank you.
now my only suggestion on this, Brad, is though we ended up buying 2 of these as far as different types. It's I don't know how else to go around this. It has to fit you right. It has to feel right, and some of them are a little bit different densities. It's got the memory foam, so it conforms to your curves. But she tried one and it didn't work. She just didn't like it.
Yeah.
And then she got another one. This is the one she didn't like actually.
There's a little bit bigger bump here than here, so I think you can turn it this way, but it doesn't feel. Right.
Exactly. You got different options. Like you can lay on your side with one way and maybe lay on your back the other way.
Yep.
The other comments that I get every so often that I see on these is that some of them have like a chemical smell, especially when they first come, and they have to air them out for a while in order to get rid of that.
Yeah, leave it on the line for a couple days.
All right, Lonnie, her husband uses a down pillow. So this has got feathers in it, and the problem with this is the reason she doesn't like, she says it's too pokey. So I don't know if she can actually feel the feathers. And you can also be, if you have asthma or if you have allergies, this might be a problem. But these do mold really nicely. They really do fit really well. They can fit into the contours of your neck and work out quite well. So that's just a down pillow. Are you reading into the comments, Brad?
Well, yeah, there's so many coming in. It's scrolling up.
Well, hit one of them. Tell me about somebody.
Well, Karen says hi, but that's all she's got.
Well, hi, Karen. By the way, we are, in some of our future ones, when we're working on this, we're going to start giving away some stuff. Because, these companies, we're showing their product, and we don't get paid for it. So we're going to start saying, hey, if you're going to give us a product to show, we're going to give away some of these to you people who are watching us. So we're going to definitely make sure that we work on that next time. Just some hints. These are just regular pillows, polyester fiber pillows. These are the kind you find in a hospital and nursing home. They're less expensive. They flatten out easier. But I'm going to show you some things you can do on your own if you just have a regular pillow, Brad.
Right.
Okay. So
we got a question from Madam X about what do you do with the scoliosis with this, and what we're doing here might fit into that, I think.
Yeah, scoliosis, that's a whole different animal, but I know there is a way that where you lay, if you have the curve,
right
up there, you want to lay on a certain side.
A pillow here, something that she could work with. Now, this is for the shoulder, but just pay attention. This could be.
This is the shoulder or pinched nerve too. Right. Again, let's say you're having a pinched nerve and you have that tendency you want to sleep on that side. Mm-hmm. What you're gonna do is you're gonna take the two pillows here, and you're gonna take a third pillow. It could be a throw pillow. It doesn't need to be a pillow. And you're going to create a canal, and this way you lay on your side. Now my neck is in the neutral position, as you can see, and I've got a canal here for the arm, so I'm taking some of the stress off the arm. So it works out really well for a pinched nerve arm or sciatica.
And then if this shoulder comes forward a little bit, that can make a big difference.
If you lay more onto your back a little bit more, that even makes more help. Now let's say we can convince you not to lay on that side, which we'd like to. So now the other option is to lay on the shoulder or the arm that's not bothering you, and you can actually lay down like this and take another pillow. And this is the painful arm now.
Yeah.
So now you take a pillow there. I know this is a lot of pillows. Buy 4 my pillows, they'll love you.
Oh yeah.
And then you stick it in here, and now look at this. Look how this is in a nice neutral position. My neck's in a nice neutral position. They all work really well, keeping that arm out of trouble.
And if it's in the wintertime, it's nice because it'll help keep you warm.
Yeah. I guess you could have your significant other lay right here.
There you go. I like that. I'm going to talk to my wife about that.
I think the whole thing is, when you understand, when you're getting pain down the arm, you need to support the neck, but you also need to support the arm. Wouldn't you agree with that, Brad?
Sure.
Absolutely. Any final comments, Brad?
Well, no, there's a lot of lovely comments here. Some are kind of too detailed for us to get into on here. But what's Alex is interested, what's a good bed for back pain?
Oh, I'm glad that you brought that up. That's a very good point. There's a website called sleeplikethdead.com.
Sure.
And if I didn't put it down below, I'll put it down below later. And this website's been around since 2008. Mm-hmm. It won't take products, so it's he's got all these different ways of how he evaluates. He evaluates mattresses, pillows, anything to do with sleeping.
Right. So it's non-biased.
It's non-biased, right. Sleeplikethdead.com, and he ranks them based on how many stars they had and all. I mean, he goes into all of it.
Right. He gets into the whole.
Yeah, I really like the site. So that should give you some.
Don't get worried about the title.
Sleeplikethdead.com. So, Brad, I think we're going to go ahead and wrap it up here.
Yeah.
Thanks again for watching. Again, like I promised you, next time we go live, I'm gonna see if we can get some things to hand out and give away. So.
Right. Yeah, because we got to eat now.
Yeah.
All right.
Bye.